When you think about MDMA, you most likely imagine young people dancing at a music festival, telling everyone they meet they love them. What you probably don't imagine is someone lying down in a small, dimly lit room, listening to calming music and telling two therapists about their most traumatic memories. But that's exactly what MDMA-assisted therapy is, and recent research suggests MDMA could be effective in treating PTSD. PTSD, or post-traumatic stress disorder, can develop after a person is exposed to a traumatic event and results in a constellation of emotional and behavioural responses like upsetting memories, nightmares, and flashbacks. Patients can be treated pharmacologically using a variety of drugs, but no single drug cures PTSD. Rather, we treat PTSD symptomatically, the psychiatric equivalent of taking a paracetamol to treat a cold. Trauma-focused cognitive behavioural therapy is also used, allowing the patient to discuss what happened with the goal of reframing the events in a more adaptive way. But PTSD is highly treatment-resistant, with only 50% of patients responding to therapy, which makes complete sense. It'd be quite difficult to sit down with someone you do not know and open up about your trauma. And that is where MDMA comes in. Although not strictly a psychedelic, the effects of MDMA on the brain are quite similar, sharing structural similarities with the psychedelic drug mescaline. MDMA affects a number of mechanisms in the brain, including serotonin and noradrenaline receptors, and release of the hormone oxytocin, the same hormone released by breastfeeding mothers. MDMA produces an altered state of consciousness characterised by euphoria, enhanced sensory perception, and increased interpersonal trust. Crucially, MDMA is not the same as ecstasy that one might encounter in a nightclub. In MDMA-assisted psychotherapy, pure MDMA is used in a controlled, calm environment. In one study, the Multidisciplinary Association for Psychedelic Studies, or MAPS, gave 107 PTSD patients 2 months of psychotherapy alongside 3 MDMA-assisted sessions. 3 months after the trials, 61% of patients no longer fit the diagnosis for PTSD, and a year later, that number had increased to 68%. Prior to their therapies, all patients had suffered from PTSD for an average of 17.8 years. Not only is this an impressive reduction in PTSD symptoms, it also suggests the MDMA-assisted psychotherapy may have addressed the root cause of their PTSD. So, how does it work? MDMA lowers the activity in the amygdala, an area in your brain responsible for the perception of emotions like anger and fear. Our amygdala works with our hippocampus, a key area for encoding memories, to remember our emotional responses to events. For example, if you encounter a crocodile, you know you should probably run away. But in the case of people with PTSD, fear responses become maladaptive, triggering recall of traumatic memories. So, by lowering the activity in the amygdala, the patient's fear response is reduced, and the patient may find it easier to discuss their trauma. Also, the release of oxytocin, a hormone that engenders a sense of attachment and bonding, could allow them to feel safe with their therapist. As such, MDMA can be the perfect aid to PTSD patients undergoing therapy, allowing them to feel safe within the environment and receptive to trauma therapy. But research into the therapeutic value of psychedelics is still in its infancy, with tight regulation of psychedelics meaning they're hard to research. However, Israel recently began phase 3 trials of using MDMA to treat PTSD, meaning for the first time, large-scale studies can be conducted to compare MDMA against standard treatment for PTSD, with the goal that one day MDMA could be prescribed in a therapeutic context.